Hi everyone, my name is Wendy Miares and I'm a pediatric nurse practitioner. I'm here to review the no-hit zone, creating a safe, secure, and supportive environment. The objectives of this PowerPoint is to learn about the no-hit zone, review effects of corporal punishment, learn key points on how to promote positive parenting, and to review how to implement a no-hit zone. The vision of no-hit zone is to create an environment of comfort and safety for families and staff in which no adult shall hit a child, no child shall hit another adult, no adult shall hit another adult, and no child shall hit another child. The no-hit zone program has a baseball background with no-hitters program. The first no-hit zone location was established in 2005 at Rainbow Children's Hospital in Cleveland, Ohio. There are currently over 174 registered no-hit zone programs nationwide, and it is supported by the Interagency Council on Abuse and Neglect, or ICAN. This is a visual map of all the current no-hit zone locations across the United States, including the one location in Canada. But let us start with reviewing what no-hitting means in this context. To hit or hitting in this context is referring to corporal punishment. But what is corporal punishment? Corporal punishment is defined as by the Global Initiative to End All Corporal Punishment for Children as any punishment in which physical force issued and intended to cause some degree of pain or discomfort, however light. In the 2018 American Academy of Pediatric Policy Statement, corporal punishment was defined as non-injurious open-handed hitting with the intention of modifying behavior. But is corporal punishment effective in modifying behavior? Studies have shown that spanking does not make children more compliant in the short term, and it is not linked with long-term compliance or internalization of morals. The effects of corporal punishment can be long-lasting. It can lead to mental health problems, difficult relationships with parents, lower self-esteem, lower academic performance, and increased risk of street drug use. It is especially important to have no-hit zone programs within high-risk demographic communities. But remember that corporal punishment transcends all demographics. The COVID pandemic has created increased stressors for families. Triggers can include monetary stressors, isolation, and mental health needs. There are 5 different levels of involvement to be recognized as a no-hit zone. Level 1 is known as the conceptual phase. At this level, at least one person is starting to formulate a plan on how to organize and implement the no-hit zone concept. Level 2 is known as the in-process level. At this level, more than one person is working on implementing a plan to develop materials and training for their staff. They have gained support by organizational leadership and have started networking with other no-hit zone locations. Level 3 is known as the basic level. At this level, training has taken place for personnel, including a plan for ongoing training, signage, and any other form of notification that the facility or organization is a no-hit zone has been implemented. Level 4 is known as a comprehensive level. At this level, training of staff has occurred. There's prominent signage and notification that the facility or organization is a no-hit zone, and at least one person has been identified as a no-hit zone representative for this organization. Level 5 is the regional level. At this level, this is very similar to level 4, with a couple of additional components. There is a community awareness and recognition that the facility is a no-hit zone. The facility provides outreach education about no-hit zone, and it is enlisting other organizations within the community or region to become a no-hit zone, thereby becoming a resource center, remembering that leadership is prevention. Takeaway points when integrating a no-hit zone is to review key aspects with providers, nursing staff, and ancillary staff. Signage is a key component of integrating a no-hit zone. Providing brochures and resources as well is very important. And at the facility that I currently work in, we're planning to have a tangible reminder consisting of a teddy bear wearing a shirt saying, "Hug me, don't hit me." This is a picture of the placement of signage in our clinics within our waiting room. And our signage are in the two major languages spoken within our facility, which is English and Spanish. Many times the concept of no-hit zone has already been established into the facility with accountability for staff and patients alike. The concept is embedded into policies for staff and under the rights and responsibilities for patients. For example, the Department of Health Services has a policy already in place under the Threat Management Zero Tolerance Policy, in which employees, students, agency personnel, volunteers are entitled to a safe and healthy work environment. Accountability for patients is under the rights and responsibilities, in which patients have the right to receive care in a safe setting that fosters patients' comfort and dignity, including being free of corporal punishment. But what do we do if we see threat or actual corporal punishment taking place? You should start by having a non-judgmental approach, acknowledging possible feelings of frustration, and offer distractions to the patient if possible by offering coloring pages provided by Child Life or distractions if available, and to try to model examples of alternative behavior. The American Professional Society on the Abuse of Children has provided the following examples of effective dialogue. If the initial response is, "Don't make me give you something to cry about," you should suggest alternative dialogue of, "Would you like for me to listen? You sound very frustrated." If the initial response is, "Sit still," you could have a suggested alternative phrase of, "Come here and sit by mommy." Another example is, "If you get out of this chair, you will be punished." The suggested alternative dialogue is, "Let's see how fast we can put all our toys away, and let's clean up this mess together." The overall goal is to create a safe, secure, and supportive environment for our patients. Help create the no-hit zone vision, which is an environment of comfort and safety for parents, families, and staff in every location and facility. If you have any questions, you can reach me through ican@lacounty.gov.